Hello, my name is Cole Aidnick, and I'm going to be covering the COVID-19 pandemic and the safety in the classroom and how we bring on-campus learning back into school. Firstly, I want to start with my research plans for this. I used Google Scholar to find peer-reviewed sources that are trustworthy and can accurately give me the proper information to do this presentation. I think I would have done a similar research plan for the other topic, the Black Lives Matter movement. After the COVID-19 pandemic outbreak, several governments ordered the temporary closure of educational institutions. The closure was meant to contain and prevent mass spread of disease with the addition of digital classrooms. Challenges were encountered as new students who are joining digital classrooms are having difficulties with taking tests and monitoring exams. As a result, education systems and policymakers and stakeholders are coming up with guidelines to strengthen the education system and bring it back to sanity in learning institutions. The first step in bringing schools back to on-campus class is community engagement. Reopening physical learning depends on public trust in government and school containment measures, engaging in communities on reopening plans built to maintain public trust. The community needs to be aware of the strategies for a safe reopening. It is not just a school that is able to reopen the classes, it is the work of the community and other public works that will make this happen. As evidenced in countries that reopened earlier, combining multiple communication methods increase public uptake and influence people's behavior on preparing children and parents psychologically for reopening. Policies and procedures need to be in place in order to make campus classes safe. This starts with hygiene standards, which include temperature screening, touchless sanitizers, and training with the school staff. The government and other education stakeholders should provide nutrition support to schools, boosting healthy feeding and immunity maintenance as well. Everyone needs to be all in on these policies and procedures as they work together to keep students safe. Another component of reopening schools on campus is being able to target the most needed resources. This depends on the continuous use of data to improve and adjust approaches on effective targeting with broad coordination. Resources and coordination have key parts in emergency responses. If structures are built back in a better way, then assets accessible for education may need to be increased and maintained. Evidence supporting the use of these resources is important for the processes as well. Why is it important to get kids back in school? Well, children are missing out from all the life skills that are gained in being in an on-campus classroom. It was also recorded that school test scores have been dropped since COVID-19 has been in place and classrooms have been closed. Most students learn better from being in a classroom, and it is important that we get kids back into the classroom as fast as possible while they're still in school. Getting children back into school can be tough. Teachers and students have brand new pressures in time, making re-entering difficult for some households as school resumes. Encouraging re-enrollment needs to be a large-scale, straight communication with parents and students that will help increase attendance. Safety procedures are going to be in place and need to be advised to the public and are taking the trust of the parents and students. Double shifting has been shown effective, where the amount of people that can be in contact with each other are limited, which has greatly helped schools and businesses reopen. In conclusion, it is imperative that kids get back in the classroom to further their educational careers. How much of the procedures need to be in place that I carefully put down with evidence, data. The trust needs to be gained from the school in order to get attendance back into the classrooms with the promotion of the new safety and hygienic standards. Thank you.